When thinking about treating this condition, it is very frustrating that we have a severe paucity of approved therapies to treat this. And what that means for a patient is that they may need to wait through a frustrating period of time while we try to work with their insurance companies to gain approval for a treatment that we feel may be effective but is not approved. That is something that, we're always happy to try to do for our patients, and oftentimes can achieve approval, but there is a period of uncertainty while we're trying to advocate for that particular medication for our patient, not knowing necessarily whether it will even be approved at the end of that process. And so that to me is incredibly frustrating, and trying to make decisions in mind where patients are not waiting too long to try to get their condition under control. What is also frustrating is that the condition itself is so heterogeneous, and some of the medications may work better for muscle involvement versus skin involvement, for example. Steroids, which are often used to treat muscle involvement and are often necessary to treat muscle involvement, we don't often use to treat skin, because the skin tends to be more chronic and then prone to flaring once those steroids have been tapered off for muscle disease and flaring that can sometimes be worse than where they started to begin with. So that can be frustrating as well for patients who have muscle and skin involvement. We can often avoid those flares as long as we're starting a steroid-sparing agent along with the steroids at the onset.